first, quickly in the chat box, what's wrong with that catheter? Why would I not give blood via that catheter? I'll go through some of the other things while we're doing the chats. Yeah, well, no, yeah, the site tape over, we can't see the insertion site. Yep, there's way too much tape. It's dirty. There's no tegaderm, biocclusive, whatever you guys like to use, like to call it, over the top. It's gross, 100%. It's a horrible catheter. We need to make sure we are giving blood during a really nice catheter. Via a really nice catheter. We generally want that catheter to be over 20 gauge to prevent hemolysis of that sample. Always do a catheter check, and always leave your catheter unwrapped throughout the transfusion to prevent it going extravascular. Make sure you wash your hands and you wear gloves the whole time. I cannot stress this enough. You could definitely, if your patient is immunocompromised, is on immunosuppressants and you're giving blood, you could definitely cause some more concerns with that patient. We're looking at that blood before we give that blood. We want to make sure it's nice and red. There's no obvious clots. We want to make sure it's the correct type. It's in date. We want to make sure that it looks good and normal, the temperature's normal in the fridge, and we want to make sure that it looks good and that's, it's in good quality as well. Warming the product. So we do not warm blood products. The only time you might warm a blood product would be if you had a neonate or a very, very small patient. However, that patient might need blood so quickly you don't have time to warm the product either. So warming products will create bacterial growth. And that blood is going to sit out of the fridge for 4 hours maximum, and that should slowly start to warm anyway in the atmosphere. All fluids, especially Hartmann's, should be stopped. Hartmann's can cause clots from the calcium in the Hartmann's. So you stop your fluids, you flush it with saline, you never run fluids alongside your blood. Food and water should be removed. You don't want to cause any nausea that could be confused with a sign of a transfusion reaction as well. Make sure you get your baseline TPR, including your blood pressure. You want to make sure you know where you're starting off too.